In 2021, the California Department of Public Health launched the California Equitable Recovery Initiative, or CERI, to strengthen equity efforts across the state. Local health jurisdictions used funds to meet the unique needs of their communities.
I'm here today in Imperial County to learn more about their efforts to advance health equity.
Hi, I'm Angela Ramirez, and I'm the Strategic Planning, Analysis, and Communications Division Deputy Director here at the Imperial County Public Health Department.
Hi, my name is Araceli Carrillo Torres, and I am the Special Projects Coordinator here for Public Health Department.
My name is Alba Pioquinto. I'm the new Special Projects Coordinator for the Health Equity Program.
Imperial County is a rural agricultural community on the U.S. Mexico border. About 73% of residents speak Spanish at home, and around 1/3 are foreign-born. Many families cross the border daily for work, school, and care, which stretches already limited local resources. Imperial is a federally designated health professional shortage area with high unemployment and a community reading level around 3rd grade. All of this makes it critical to have a local public health workforce that can truly meet people where they are.
I thought I knew what equity was until I landed this role.
The communities we serve here in Imperial County are predominantly Hispanic. We are at the border of Mexico and also at the border with Arizona. There's a strong cultural connection with the border. So we have a lot of people crossing in and out of our border. Some people live in Mexico and come over here to work, or vice versa. So there's a lot of integration with Mexico.
We want to make sure that we are culturally aware and sensitive to those needs, and also have individuals within our department that can truly reflect the communities that they serve.
Using their local health equity plan as a roadmap, the Imperial County Public Health Department has been building the infrastructure to move equity from ideas into everyday practice. Through CERI, they've been able to test new approaches, strengthen relationships, and lay the groundwork for more sustainable community-driven change.
It was important for our department to build this plan because we needed a roadmap to really guide our work, guide our programs and our activities to help our staff and help our community.
There are so many competing priorities. Sometimes it can be a bit challenging to really kind of hone in on what we want to prioritize and work on first, because we know that all of them intertwine.
We serve a community that has a reading level around 3rd grade.
Language access is an equity issue because how are we sure that we're providing the great services or we're understanding our clients when we don't share the same language? So the language access needs assessment provided us that data that we needed to be able to tailor our services with the company that we use to be able to provide and be inclusive and accessible. So when clients would come in, we're ready to receive them, and being able to fully understand their needs and making sure that they fully understand us as well.
Through CERI, the Imperial County Public Health Department focused on building their own awareness and skills so they could serve the community in the best way possible.
Living and working in the U.S. Mexico border, we do see how community and culture shapes people's health. And I feel that having a workforce that understands equity can help them connect more with the community. It helps them make them feel seen, heard, and it really help us able to tailor our services to something that they really need.
Having that awareness within the workforce of health equity provides us with the skills and knowledge and the awareness to, when someone comes in, to look at the person, right? Or not just another client, but actually look at the person. And that's what we wanted for our workforce, to be able to have that awareness and serve our community in the best capacity that we can. So any new employee who comes in takes the implicit bias training. They are now trained, they now understand what health equity means, and they can also expand that knowledge, to the community.
Equity is not new to public health. Public health truly is at the core of it. It is equity. All the work that we're doing is to improve and be a voice and stand up for individuals.
We need dedicated staff to focus on health equity. not only that, with initiatives or activities, but also finding the gaps, continue finding gaps, continue to improve the process that we have.
The SERI funding really brought the equity infrastructure that we needed, not only through our department, but through Imperial County. It also allowed us the opportunity to travel for our own capacity building as the SERI convening and meet new people that were at the same space as us in other counties, regionally. So it was great.
They took part in trainings on racial equity, LGBTQ plus competency, climate equity, grant writing, and trauma responsive leadership, and even launched an equity office hours to keep the learning going.
I'm happy to know that they feel comfortable in coming to a space where they can ask questions, where they can ask for our recommendations, and making sure that they're able to integrate all these equity components to the work that they do.
I really am proud of the establishment of the dedicated equity coordinator.
The department saw the need, the department saw the importance, and now the department is supporting the special projects coordinator with county funds. So that's a win that SERI brought.
Being able to have the opportunity to do capacity building for our staff and also being part of a bigger regional effort. It created this equity space to learn from our counterparts in other counties. We shared a lot of lessons learned and gave a sense that we're really not alone in this work.
Looking back on the journey, the team at the Imperial County Public Health Department has some powerful lessons for current and future public health practitioners about what it really takes to advance equity on the ground.
There's always going to be challenges. There's always going to be barriers. There's always going to be political, issues happening. But truly, you can still continue moving forward and remembering that a small win is a win.
Equity takes time. It's a culture change. It's something that we learn to do. It's something that we can learn.
I think that's why it's so important too, to bring in your team, to bring in those people who are like-minded, that can support you, that you can lean on. And I will say partnerships and collaboration are absolutely key.
The equity work takes courage and patience. Let me tell you, patience.
Health equity brings you together. Like you can't learn about or work in health equity and not build relationships. It brings you together because you can relate. I was from there. I was from this background. Oh yes, me too. And you start learning and empathizing with a lot of people, leaders, community, and it just brings you together.
You just have to act with compassion, empathy, and be open-minded.